Hello there. It is my pleasure to provide you some practical information to help you through your surgical procedure. It is completely normal to feel nervous about the unknown. Together, we will explore how to best prepare, what to expect, as well as the best way to get involved in your recovery of your upcoming surgery. All information presented is recommended and supported by medical research, including the recent recovery pathway created by ERC, standing for Enhanced Recovery Canada. When compared with traditional care, using parts of ERC has been linked with less pain and shorter hospital stay, while at the same time improving patient satisfaction and quality of life, which permits you to recover more quickly and go back to your routine activities faster compared to standard surgical care. Benefits have been reported for patients undergoing colorectal procedures. Planning ahead of your surgery and going in as healthy as you can will have a positive effect on your procedure and recovery. Pre-operation information and preparation can reduce fear, fatigue, and pain while speeding up the recovery process. Like a marathon, a surgery is something that is best approached when one is prepared and takes the appropriate measures to recover from such a physically and mentally draining day. You should spend the time before the surgery being as active as you can, whether that involves going for short walks or exercising, eating right, and getting a good night's sleep. If you smoke, you should try to stop as soon as possible, because smoking can cause problems with breathing, slow down the healing of your scars, and affect your overall recovery from surgery. If you need help quitting, you can talk to your doctor about different options that are right for you. If you drink alcohol, you may want to decrease or stop your alcohol consumption for a few weeks prior to surgery, and avoid drinking any alcohol 24 hours prior to surgery, as lowering your alcohol can also decrease complications during and after your surgery. Based on ERC, and to be confirmed by your healthcare team, you may eat and drink normally up to 8 hours before your surgery. You must stop all solid foods 8 hours prior to surgery, although you should continue to have clear liquids up to 2 hours prior to surgery, unless you're told otherwise by your surgeon. Clear fluid is a liquid that you can see through. Examples include water, sports drinks, fruit juices without pulp, and tea or coffee without milk or cream. Some patients may need to have their bowels prepped or cleaned prior to surgery. If this is the case, your surgeon will prescribe the preparation and explain when to take it. If you are taking bowel prep, you will also need to take antibiotics with it. Patients receiving bowel preparation should only drink clear fluids afterwards until 2 hours prior to their surgery. Recommendations include having one carbohydrate drink, such as clear juice, 2 hours prior to your surgery. You may also be given a special drink called maltodextrin by your healthcare team. If so, drink it according to the instructions. Before surgery, patients should shower or bathe full body with 4% chlorhexidine gluconate soap the night before and the morning of their surgery, as it has been associated with a lower risk of surgical site infection for patients undergoing abdominal procedures. Do not shave the region where you will be operated on, as this will be done for you at the hospital. The day of surgery. Try to bring a family member, friend, or someone to be with you. You won't be allowed to drive after surgery or even after a few days in the hospital, especially if you're taking pain medication. Plan to have someone take you home. Wear or bring loose-fitting, comfortable clothing. Your belly might be sore or swollen from surgery, or you may have bulky bandages. Leave jewelry and valuables at home. Please bring with you your valid Medicare and hospital card. If you use a CPAP machine at home, please bring it with you also. Bring any medications that you take regularly in a labeled pharmacy container approved by your healthcare provider. Contact lenses, glasses, dentures, and hearing aids must be removed prior to going to the operating room, but please bring them with you so you may use them after surgery. Stay warm while you wait. If needed, keep your sweater and socks on until called to the operating room. On the day of the surgery, the admitting nurse will likely check your temperature, blood pressure, pulse, and breathing, review your medication, and help you get ready. You will receive some medications before and after surgery to improve pain control. An intravenous tube, called an IV, will be placed into a vein in your arm to allow you to get fluids and medication. When you are ready, someone will help you onto a stretcher and take you to the holding area, and then to the operating room. Immediately after your operation. Important aspects to focus on after your surgery include pain control, bowel function, diet, and patient mobilization. When you wake up after surgery, you may feel cold and have pain in your belly. If you had laparoscopic surgery, you may also feel pain in your shoulders. The shoulder pain is due to a gas that is used to inflate your belly during this type of surgery. Pain is different for each person. If you're having pain or feel like vomiting, tell your nurse, who will help you get more comfortable and give you medications. You may wake up with a urinary catheter, which is used to drain urine from your bladder into a small plastic bag. This catheter is usually removed 1 to 2 days after your bowel surgery. Your throat may feel sore from the tube used to help you breathe during surgery. If your mouth is dry, you may have some ice chips when you're fully awake. Feeling tired, stiff, or achy is also normal at this time. These feelings will go away when you can move around more. Some patients feel sad or blue after surgery. These feelings are normal. As your body heals and you're able to go back to your activities, these feelings may go away. Please talk about these feelings with your nurse, a friend, or someone in your family. If you feel overwhelmed by these feelings or they do not go away over time, please get help from a healthcare provider. When you wake up, it is important that you do some deep breathing exercises. Breathe in deeply through your nose and relax the air out through your mouth. Try to do this 10 times an hour. You'll be given an incentive spirometer, which is a device used to help you open up your airways after surgery. When you feel like coughing, don't hold back, but try holding your belly to control the pain while you cough. The medical staff may help you out of bed after your operation. You should try to spend up to 2 hours out of bed on the day of your surgery. If you feel faint or dizzy, call the nurse to help you get back to bed. Some patients need an ostomy, also called a stoma, as part of their bowel surgery. An ostomy is a small opening in your belly where stool and waste pass out into a bag. This might be temporary or permanent. If you do need an ostomy, your surgeon will talk to you about it before your surgery. You can also meet a nurse that specializes in ostomy care during your time in hospital. This nurse will teach you how to clean and take care of your ostomy and ostomy bag. There's usually no restriction on your diet after surgery, but your surgeon will order the diet that is best for you. Starting to eat early after your surgery has been shown to help your bowels get back to normal, keep normal blood sugar levels, and reduce the risk of complications. It is important that diet as tolerated, or standard diet, is not the same as force feeding, and that patients should eat based on how they feel. The following days. Diet. It is important to stay hydrated during your recovery. High protein, high energy drinks are ideal after your operation to help your body heal, reduce the risk of infection, and help your overall recovery. You may also encourage family and friends to bring in some of your favorite foods from home. Mobilization. On each day after your surgery, you should sit in the chair and walk as much as possible, with some periods of rest in the bed as needed. Your medical team will place compression stockings to decrease the chance of blood clots in your legs while you're lying in bed. You should also do some leg exercises, such as bending your knees, rotating your ankles, and pointing your feet up and down. Once you're able, you should walk along the ward corridor as much as possible. Being upright, getting out of bed, and walking will help your breathing, increase muscle strength, and decrease the chance of blood clots forming in your chest and legs. After your surgery, the healthcare team might suggest that you receive medication to prevent blood clots for up to 28 days after surgery. This medication is usually a small daily injection that can be given by you, a family member, or a nurse. Criteria for discharge. There are certain criteria that allows the healthcare team to decide when the patient is ready to go home. For patients having bowel surgery, this usually includes eating a regular diet, being able to mobilize, going to the bathroom, good pain control, and no signs of complications. You should plan in advance for your discharge from hospital. You may need someone to help you for a few weeks. Although it is not always necessary, some patients feel more confident to go home if a friend or family member can stay with them for a short period of time. Post-hospital recovery. Abdominal pain. It is not unusual to have belly pains during the first week following surgery. If you have severe pain that is not controlled by your pain medication, or a fever and feel generally unwell, you should immediately contact a healthcare provider. Your wound. It is normal for your surgical site to feel slightly red and uncomfortable during the first 1 or 2 weeks. You should contact a healthcare provider if your incision or cuts become more swollen, red, or start to discharge fluid. Diet. A balanced, varied diet is recommended. Try eating 3 or more times a day. You may find that some foods upset you and cause loose bowel movements. If that is the case, you should avoid those foods for the first few weeks after your surgery. If you're finding it difficult to eat, it is still important to get an adequate amount of protein and calories to help your body heal. You may benefit from having 3 to 4 nourishing, high-protein, high-calorie drinks in addition to your meals. If you're suffering from diarrhea, it is important to replace the fluid loss and to drink extra fluid. If you're losing weight without trying to, or are struggling to eat enough, you should contact a healthcare provider. Exercise. Walking is usually encouraged starting the evening of your surgery or the day after. You should plan to start regular exercise several times a day and gradually increase this during the coming weeks following your surgery until you reach your usual level of activity. The main restriction on exercise is usually not to undertake any heavy lifting, no more than 5 to 10 pounds, or any contact sports until 6 weeks following your surgery. In addition, if you're planning to restart a routine exercise such as jogging or swimming, you should usually wait until at least 2 weeks after your operation and start gradually. Common sense will guide your exercise and rehabilitation. In general, if the wound is still uncomfortable, modify your exercise. Once the wounds have completely healed, you can normally undertake most activities. Driving. You should not drive until you're confident that you can drive safely. A good yardstick for this is when you've returned to most of your normal activities and no longer taking any strong painkillers. Usually, this will be within 2 to 4 weeks of surgery. It is important that your pain has decreased and that you are not taking any medication that would interfere with your ability to react properly in the event of an emergency on the road. Hobbies and activities. You should consider taking up your hobbies and activities as soon as possible again after surgery. This will allow you to maintain your activity and help your recovery. You should not need to restrict these unless they cause significant pain or involve heavy lifting. Tiredness. It is frequent to feel low energy levels following surgery and anesthesia. It is important to mix activities with some rest as needed, but to get out of bed each day and get dressed if possible. In summary, to enhance or boost your recovery, you will benefit to return gradually to normal as quickly as possible. This means that you need to actively participate in your recovery by walking, eating, and drinking. Each day, you should feel some improvement, but do ask your healthcare provider if you're worried about something. It is our hope that this video makes you feel more confident about what's ahead. On behalf of our team, we wish you the best on your journey.